Honorable Session Chair, host of the event, participant, good day. This is paper ID 344 entitled 6G Access Network for Intelligent Internet of Healthcare Things, Opportunity, Challenges, and Research Direction. I am M. Shamim Kaisar presenting this paper on behalf of all of my co-authors. These are the outline of my presentation. Let's move to the motivation. Before starting my presentation, let me define healthcare. Healthcare is the management, improvement of health via prevention, diagnosis, treatment, illness or other physical and mental improvement in people. Healthcare services are provided by health professional and allied field. With the rapid development of ICT infrastructure, deployment of Internet of Things node, and better understanding of machine learning approaches, the healthcare services has changed. Healthcare services are not only provided by the health professional and allied field, and also AI-enabled interconnected medical nodes are assisting the system for getting the optimized result. Initially, the healthcare system was service-driven. It was inconsistent. Data exists in paper and location dependent. Now it moves to the patient-centric healthcare. Patients are becoming active participants in the patient-centric healthcare and they want to contribute to their own care process. Advantage of patient-centric healthcare includes increased engagement between the patient and healthcare provider, and the patient will be well informed about the health condition and treatment option, which leads to better care. And also it will ensure improved resource allocation and medication and medical care planning, which will help them to medical care planning. So with the healthcare and Internet of Things, many people are getting connected. So it will actually increasing the healthcare data volume. Look at the pattern. This is actually exponentially increasing. And also the volume of unstructured data is also increasing, and the volume of healthcare record structured data is also increasing. That is, in overall, we can say the healthcare systems with the interaction of IoT is generating huge volume of data. This is an example of Internet of Things when integrated with healthcare. We can term that one as Internet of Healthcare Things. Patient with implanted medication device. And this implanted medication device are actually used for medical therapy to treat disease or improve quality of experience. So with the IIoHT, the systems can generate optimize decision for the family, friends, patients, as well as healthcare professional and healthcare systems. So with the introduction of Internet of Healthcare Things, the patient-centric services are becoming the reality. So now the 3.5 million medical devices are in use, and the security and trust is a challenge because many heterogeneous nodes are connected to each other, which are the actually weakest link for cybersecurity. And the data volume are increasing, and also for real-time communication, end-to-end device communication, we require high bandwidth and high speed services with low latency. As we mentioned, the connectivity is increasing and generating huge volume of data. So what will be the access network then? So the access network should support this ultra high bandwidth, high speed connectivity with low latency. So we should move towards 6th generation access network. 6th generation access network 6th generation access network compared to 5G, it can support more connectivity, support ultra high speed communication with low latency, and also support mobility. We can have holographic media, trusted infrastructure, and also telepresence. That is, the doctor will present where the surgery is going on. I mean, the virtually doctor can be there also. So this is the diagram for a sixth generation communications scenario for intelligent IoHT. The access networks are actually short range, which can ensure the security, and the speed is terabit per second. That is, we can have real-time data transmission and can transmit large scale or huge volume of imaging data or medical data. So this is the layer structure of intelligent IoHT. The lowest layer is termed as intelligent sensing layer. It is actually here the pervasive sensing elements are connected, and they are collecting data from the patient, and this data are processed by the fog layer and mist layer, and finally the redundant data were dropped, and then we send huge volume of medical data through the ultra high speed access network, which is the 6G network, to the cloud for further processing. If we have high speed cloud devices, in that case actually the processing time is negligibly small. If access time is negligibly small, with the introduction of 6G, in that case we can have real-time communication between the end-to-end devices, and we can design the better application for the healthcare systems. So as we mentioned, we need terahertz link, high speed link, short link, so that they can provide secure communication, and the communication should be intelligent, that is AI enabled communication systems. If there is a problem in the network has to be healed by itself, and the quality of experience between the end devices should be improved. Quality of experience and quality of service are different. Quality of service is what the system offer, and quality of experience means what we feel. And also it should support tactile and haptic internet. What is haptic internet or haptic communication? Haptic communication is a branch of nonverbal communication that refer to the way in which people and animal can communicate with each other through sense of touch. And on the other hand, the tactile internet refers to internet-based control of application with extremely short response time, which cannot be intercepted by human beings. So that way actually we can control all the devices with no time, and people cannot feel anything. If this is true, in that case a person sitting at the New York can do a surgery in Bangladesh. It is possible. So we are expecting the upcoming 6th generation access network will provide tactile and haptic internet, and definitely the infrastructure has to be super massive MIMO, and it should also support quantum communication. We know that the speed of light is the highest, right? So we can have if we have the quantum communication, then actually we can have ultra high speed services. So the possible services provided by the 6G is holographic communication. Holographic communication means holographic telepresence is possible. That is, doctor is sitting at the New York, can be present in another location. and also support augmented reality and virtual reality. And this can be used for rehabilitation purpose, and also I mean to understand what is the anatomy of the human body, or the augmented reality, it will be helpful for the medical student for do some kind of surgical planning and minimality invasive therapies. So medical robot can assist surgery, and telerobot rehabilitation systems can help people to rehabilitate. And exoskeleton is actually a robot which can help people who has a problem with the spine or skeleton. And telesurgery is actually, we already mentioned, the telepresence and govern the robot assisted incision. Epidemic and pandemic. For epidemic and pandemic, we already used different robots, and if we use the 6G network, in that case it is possible to with the haptic communication, it is possible to control all the devices from the remote location, and it will help us to do remote healthcare monitoring and telehealth consultation. And also wireless body machine interaction will help us to get information of a body, and also the assistive devices. Future research challenge. Intelligent capability of medical devices is a challenge. We need to do the further research on intelligent capability of devices, how we can integrate into 6G IoHT system. And the high channel loss is a blessing, at the same time it is a challenge, so we have to come up with some kind of solution so that we can compensate this high channel loss. And intelligent resource management is always a challenge for the wireless access network, so we have to explore this resource management. And federated learning, this is a new form of learning which can be employed in the cloud environment where all the data are encrypted. So the federated learning is important, and we should explore the federated learning because all the data should be encrypted when they will be transmitted from the devices. And also challenges for deploying deep learning algorithm in the fog and mist. So this is also a huge challenge. So this will provide us some kind of opportunity to do in future research. And concluding remark is intelligent Internet of Healthcare things will be paradigm shift in healthcare services, and this is required for patient-centric healthcare. Intelligent fog, mist, cloud computing is crucial, so we should take care of this one. That is, how much data should be processed by the mist, fog, and cloud. It should be well defined. And 6G cellular network with multidimensional communication strategy have high prospect in intelligent Internet of Healthcare things context. Thank you very much for your patience. If you have any question, feel free to ask me.